This is Health, Wellness, and You, and today we welcome Dr. Nicole Culos-Reed from the University of Calgary. Dr. Culos-Reed, I want to start by asking you this. What are some of the most significant challenges to maintaining our overall health during this current situation?
That's a great question. I think we've seen a couple of things. One, we know in general, physical activity levels have diminished. So we're seeing a decrease in people's movement overall. Now, that doesn't mean there aren't some subpopulations that are able to walk more in their neighborhoods or get out a bit more. But in general, people stop going to the gym, their usual fitness classes. Many people are working and staying at home, and there was a lot of just stay at home, right? And so I think we saw physical activity levels overall decline. And because of that, we see a number of health diminishments, decreases in physical, functional, social, emotional, and mental well-being have all diminished because of that lack of physical activity. There's a larger movement called Exercise is Medicine, and it's an international movement, and we have a strong Canadian group in that. And it really is true that exercise is one of the very best medicines we can do for our overall health and well-being. So when we take that away and people are naturally more sedentary, we're seeing those lasting impacts.
You've touched on it there, but let's go a bit deeper into that point. In what ways is physical activity and exercise kind of pouring over and benefiting other areas of our health, like our social, mental, and emotional health?
Yeah, so sometimes I think there is that pour over, as you just said, and sometimes it's really independent of, right? So we know that for some of the physical changes associated with exercise, a certain dose is often required, right? So if you think of fitness outcomes, we need a certain dose for somebody to build larger muscles or to get more aerobically fit. Sometimes that pours over, as you said, into other domains. So if when they're more physically fit, they may have more energy to therefore socialize and to engage in those relationships that really bring them that sense of well-being in that social domain. Other times, however, I think you can think about physical activity and its independent impact. By that, I mean decreasing depression, anxiety, and stress. And so when we can use exercise simply for those outcomes, it doesn't work through physical changes necessarily. It's got an independent effect on those outcomes. So we know that exercise is one of our best tools for, non-severe levels of clinical depression, right? It's as effective as some of the standard drug therapies and doesn't have any of the negative side effects. So often we're looking at some of those benefits. Sometimes being in a physical setting can afford people social connections. It can afford people feeling better, that endorphin rush. So there is a physiological link to some of those more mental health outcomes. But I think if you think of your daily activities, and sometimes when you're stressed out and you just need a 5-minute break outside, and that recharge, we wouldn't count it as exercise per se, but that movement absolutely has you feeling more in control, decrease your stress, and now you're ready to go back and tackle whatever's next.
Dr. Culos-Reed, as you keep a close watch on all the research and understanding the importance of attending to our physical health, can you share your thoughts on how we can best get connected with a healthy physical activity routine right now?
Yeah, and I think one thing we've really seen the fitness industry do well is pivot and start to engage and do more outreach with online offerings, right? So as some of our public spaces are closed, or for certain populations that even as they've reopened, they're not comfortable going into them, or they may have health concerns that prevent them, they might be higher risk populations. Or for many of us, especially working moms, we're busy juggling work and kids, and getting to a class even once it's reopened isn't an option. And so the fitness industry has been really great at pivoting, and there's a plethora of online options, everything from yoga programs to HIIT classes, that you boot camp kind of style that you do at home, to aerobic activities. So I do think part of that has made it much more accessible for many people. Even people that were going to the gym before are finding there are certain things. And there's really well-known platforms like Glow or Peloton or Alo Moves that, are big subscription services, but there's tons of free offerings. There's tons of smaller groups and targeted programs for specific individuals, whether we're talking elderly or we're talking moms with new babies. So I think doing your due diligence and looking at what's out there and really asking, who's leading these classes and are they designed or tailored to meet my needs will help people feel more engaged and then more willing to do them from their own homes.
Okay, so in order to get on track with a physical activity regimen and all the health benefits that come along with that, where's the best place to start?
Yeah, so I think there's a couple important steps so that people can ensure they're doing the right thing for their body. And number one is we are all the best experts for our own body. So if something doesn't feel good when you try it, then don't do it, right? And I don't mean, hey, I'm really out of shape and I'm breathing a bit heavier and I can feel my muscles. Those are actually good side effects of exercise. And if you're new to it, you're going to feel that. But there are things like screening. So when we work with chronic disease populations or people that are at risk with comorbidities, we'd want to screen them to make sure it's safe for them to engage at home. So if you're joining a specific program, you can see if there's a screening element to it. Everybody could go online to our one of our sites, and Participation might have this, but the Canadian Society for Exercise Physiology, CSEP, has a Get Active questionnaire, and you can self-screen just to see. And if there are red flags, then talk to your healthcare provider, see what else you might need to consider. So that's safety first, right? And then it's about what's accessible, and that comes down to finances. Some are paid. There are a lot of free, though, and good free options out there. What are you looking for? So what do you enjoy doing? What fits your lifestyle? So, and what benefits are you looking for? Are you looking for strength gains? Are you looking for aerobic gains? Are you looking just to connect with others? Lots of online programs are doing a good job about building that sense of community, that social isolation we're feeling, which is so tied to our mental well-being, but then also our physical well-being, right? If you can also work out but connect with other people, I think then you get the best of both worlds and the multitude of benefits.
Dr. Culos-Reed, we're all looking ahead to the winter right now. I think this winter we can expect a lot of time at home, some disruptions to our regular routine, challenges to our overall health and sense of well-being. And that's on top of a winter season that often poses challenges in a regular year as well, with seasonal affective disorder, things like that. Is exercise going to be one of those vital tools that we lean on to ensure we get through this COVID situation and remain intact with the best possible sense of health and well-being?
I absolutely think it's going to be a critical factor for helping people feel well, but also feel in control, right? We're thrown into this pandemic where we can't control what's going on at the big system level, right, in our environment. Choosing to engage in movement every day, whatever that looks like for you. It could be a walk. It could be a stroll and then grabbing a coffee to go with a friend, right? Make it social. It might be cross-country skiing. We've got snow here in Calgary too, and I'm going to put my skis on this afternoon and get out for a few minutes. Snowshoeing, whatever it is, figure out what you can do on a regular basis that works for your lifestyle. But having that ability to make that choice on a day in, day out, it becomes under our control. And so when we can't control other things in our environment, one of the key aspects for us to feel mentally well is to have that sense of competence and control or self-efficacy that we can do things that are good for us. And exercise is a lifestyle behavior that it's an easy choice. It's hard to do. It's not just as simple as, brushing your teeth, but if we can start to build that habit, and even honestly, if you're getting 5 to 10 minutes a day of movement, that's better than none, right? So if you're starting there, a little breath of fresh air, whatever it might look like, if you can do a class in your home, tap into some online programs, that's even better, and get more structured exercise, so more of the benefits that come from that. But I think we all have the choice, and so we're the online industry, the fitness industry, research that's going on really shows there's so many benefits by doing this on a regular basis. So if we can support people and make it accessible throughout this long winter where it might be even more challenging than our usual cold prairie winters, we might have the chance of hopefully positively impacting some populations that wouldn't normally be engaging in physical activity.
Dr. Nicole Culos-Reed from the University of Calgary, professor in the faculties of Kinesiology and the Cumming School of Medicine. Thank you very much for your time and sharing your wonderful insights on how we can perhaps get better aligned with our physical, mental, and emotional health.
You're welcome. Thanks, Matt, for having me.